Hi, everyone. Rochelle here, and Dr. Dana Philisaint, welcoming everyone back to another episode of MindCare. Today's topic is how to address the physical symptoms of trauma from a health perspective. Now, we're still sticking with the Trauma at Home series, and I hope you guys have been enjoying these podcasts. Now, this podcast aims to provide hope and answers and take away the stigmas of childhood traumas. Dr. Dana Philisaint is a professional counselor whose focus is on childhood traumas. Hi, Dr. Dana Philisaint.
Hello, and welcome back.
Wow. So today is we're still talking about the trauma at home. And so today's topic is how to address the physical symptoms of trauma. So, of course, the first question is, what are the physical symptoms of trauma?
That's a good question, of course. So, everyone reacts to trauma differently, no doubt about that. But a lot of us know most of the emotional reactions that come with trauma, but there are quite a few physical symptoms as well. And so this is great that we're talking about the physical symptoms. So some of the common ones, here's some of the common ones. Things like insomnia, nightmares, night terrors, racing heartbeat, and even high blood pressure some people might experience. And if you're a diabetic, that individual might have a hard time trying to balance out their blood sugar level. Some research shows even aches, body aches, and pain for no particular reason at all. Withdrawal from social situations or even personal relationships are interrupted. Hyper arousal of just being alert, always at a state of alertness. Feeling numbness at times in their bodies and muscle tension, even their mental health, but cognitive processing issues. Some of them have issues with, like concentration, with memory, or even problem solving, and headaches. There are some individuals that also report digestive issues and even chronic health conditions, not at all related to injuries, but just due to the stress. And so there's tons of physical symptoms that are very common for people during, after, trauma has taken place.
Okay, so you talked about this during, before, and after. So I guess the next question would be, when do these physical symptoms of trauma usually start to manifest themselves in someone's body?
Okay, so this is all after, okay, or even during the trauma. But research, when it comes to looking at trauma, indicate that children are especially vulnerable to physical impact of trauma because their brain is still developing. So children experience a heightened level of stress, and particularly, of course, during the event, but their body, even afterwards, might release some hormones due to stress and fear that's associated with it. And so there's a disruption in normal brain development, and that leads to chronic pain or even physical pain at any age. So there's no real tied age connected. It depends how the body reacts and at the time that it reacts to some of those symptoms. A prolonged period of stress brings on a lot of these physical elements as well.
Oh, wow. Okay, now you talked about chronic pain. So first of all, I need you to explain what chronic pain is, and then how is chronic pain connected with trauma?
Okay, so, studies have shown that chronic pain might not only just be with the physical injury, that's typically what it's associated most of the time, but stress and emotional issues can bring about chronic pain. And chronic pain is defined as a prolonged physical pain that lasts for longer than natural healing process should allow. So people who suffer from pain will experience the pain even in the absence of injury, in the absence of inflammation, when they do tests to see if there's any other situation in their blood. Their blood level might be normal, and it's it has nothing to do with the physical ailments that the body might have from the nerves and so forth. It's just they feel that this debilitating pain or discomfort, have problem with moving around, like they should normally. So chronic pain is associated with, feeling of hopelessness, depression, anxiety because of trauma. So this type of pain really sometimes referred as psychosomatic pain, and it's one of those where it's not related to injuries, but because of these emotions that's so heavy upon the person that they actually can feel it physically.
Okay, so you talked about psychosomatic pain. So can you explain what that is? And then how does the stress of trauma bring about this psychotraumatic pain?
Okay, so, there's study that shows that the more anxious a person is, the more stressed a person is, the more tense and constricted their muscles become. And these cause the muscles to become, very fatigued over time, or, not able to do the work that it should be doing because of this discomfort it has. So it's a physical pain that brings about this psychosomatic, but it's typically related to stress. It's not a physical ill injury that this person experienced. And so, studies, when they look at psychosomatic, it's a really good way of looking at the body and the mind working together, really, And so a lot of the studies on trauma itself gives us a good indication of how you can see the mind and the body are very much connected, where one is impacted and the other kind of just come along with the pain as well. So that's the whole psychosomatic part of it.
Okay. Now, I know, and I'm sure our listeners have heard of this, but we're talking about cognitive behavioral therapy. How does cognitive behavioral therapy help with, this kind of trauma?
All right. So that's actually the number one most common treatment for psychosomatic pain. It is cognitive behavior. So cognitive behavior therapy, what it does is actually helps the person to analyze, to examine, and to, even form belief systems that can really give them a good indication of what their health and physical symptoms is all about. And it also helps them to reduce their stress. It helps them to cope and address, a lot of the psychosomatic issues or physical ailments that they have. A good psychotherapist, not psychotherapist, but a cognitive behavior therapist will actually examine the lifestyle of the individual as well, giving them some cause and effect issues and helping them analyze, what are some of the cause and effect of some of their situations. And then also look at ways to reduce preoccupation with their symptoms, reduce the avoidance of situations. Some people might be avoiding a lot of situations as a result because of the discomfort that they have due to the physical situation, physical pain that they're experiencing. So it also helped them to improve their daily functioning at home, at work, in a relationship, in social situations. And, of course, it addresses any other, mental health disorders or even depression that individuals might come across. So it's when used properly, it's phenomenal. And there's tons of research on cognitive behavior therapy and the benefits of that.
Oh, wow. Now, I know this podcast is all about providing hope and answers. So in your response, you touched on lifestyle approaches. And so can you provide for our listeners, what are some lifestyle approaches that they can consider to help provide some relief for some of these physical symptoms of trauma?
Okay. And so, of course, this information is to give people more education for educational purposes. If they're deciding to change anything in their lifestyle, or their physical health, make sure you consult with your physicians if you're listening to this podcast before you change anything. But there are 8 areas that I would say, if individuals rightly analyze their life, see how they can place those in the right order so that they can have the benefits of physical health as well. And there's an acronym that many people remember it by. It's called God's Plan. And the G stands for something, the P stands for something, and so forth, and so forth and so on. So, for example, godly trust is the first one. So, the Bible talks about how we need to lean upon His strength and, turn our stressors over to Him because He wants to help us. A good indication of that is found in Matthew 11, verse 28 to 30. Come unto me, all who labor and are heavy laden, and I will give you rest. God wants us to come to Him and share our burdens with Him, right? So then, O is open air. There's tons of studies, again, that talks about how we get so much benefit when we take deep breaths and actually have, open air, outside, fresh air coming into our lungs, and it impacts our brain to give us clarity of thought. And then D is daily exercise. So not only exercise when you feel like it, but daily exercise is important. Of course, there's research on how exercise improves mental health and your mood. Doing exercises, your body releases chemicals that can improve your mood and make you feel more relaxed. So again, we're talking and dealing with the stress issue that we have, and so it reduces the risk for people even experiencing depression and those kinds of things. So that's O. And then S would be sunshine. Sunshine is important. We know that exposure to sunlight is taught to increase the brain releases of hormone called serotonin. Serotonin is associated with boosting your mood and helping the person feel better and to be able to focus more. So that's important as well. Another would be proper rest. So important. We can't undermine or underestimate the value of a good night's rest. 7 to 8 hours of good night's rest is found to be very beneficial, preferably if you do it before midnight, A lot of times people wait till their body is so tired and they're trying to finally fall asleep. And, by that time, too, a lot of the benefits of rest they don't get. And so that's another one. And L would be lots of water. Our body, I don't know if many people are aware of that, is made up of over 60% of water, our whole entire body. So according to, journals from biological chemistry, the brain, the heart, combined makes up 75% water. The lungs, 83% water. The skin, 64% water. And the muscles and the kidneys, 79%. The bones. So everything about our body needs water to function, to survive. And so when we give it water, it helps the healing process as well. So we can't undermine the need for, good water. Another one is always temperance. People always ask me, what is temperance? Temperance is abstaining from things that are bad, and we're talking about alcohol, smoking, tobacco, those kinds of things, right? And then, but moderation in things that are good. So that's when self-control comes in. And also learning when to say no, learning when to say it's enough, learning when to say I'm done, stop. Those kinds of things. That's all about temperance as well. And the last of that acronym is nutrition. So there's tons of research, again, that talks about how eating a well-balanced diet of grains and seeds and vegetables and fruits are good for our brain and our body to function very properly. And if we provide our body with the right nutrients, we get the energy that we need to keep our body active throughout the day, and these nutrients will help our body to not only grow but to repair itself when it needs to. So it helps us to stay strong and get to a healthier state. So, there's so much we can talk about, when it comes to nutrition and lifestyle. But I think for our listeners, to just remember that, these are very good lifestyle changes that they can make with the help of their physicians. To look at ways they can improve their self overall, physical, mental, and spiritual as well.
Wow, those were definitely some fantastic points, Dr. Dana Philisaint. I think one of the takeaways, at least for me, was, realizing that the body is a unit. It's not just one piece, but they all have to work together. So that's definitely amazing. And for our listeners, don't forget, if you want to review everything, you can definitely go to the website, mindcare.us, for resources and additional information. Dr. Dana, do you have any final closing points for today?
That's all. If our listeners have any questions, feel free to, as mentioned, contact us. But a lot of things that we do in our sessions is to make sure that we go deep, not only in the mind, but we talk about the physical health as well as the spiritual health, which I believe is all very much important for well-being.
Absolutely. And don't forget to like and subscribe. See you all in the next episode. Bye.
Bye.